Currently, dengue cases are increasing in India. There has been one death in Delhi, and total in 2024, we have seen close to 30 deaths, out of which 22 are in Kerala. Dengue is caused by dengue virus, and there are four types of viruses: dengue virus 1, 2, 3, and 4. And even if you get infection from one virus, you do not get immunity from the other viruses. So to get complete immunity, you need to have four different type of viruses infection at four different occasions. However, for short term, it can give some immunity. There has been no vaccine for dengue, which can be used in India. Dengue is a vaccine in Australia, but that cannot be used in India because if Indian people are already infected with one type of dengue and vaccine is given, there might be a reaction. So before that, we need to check IgG level, immunoglobulin level, and then decide. In dengue, the transmission is through Aedes aegypti mosquito. The mosquitoes are larger than Anopheles mosquito, which causes malaria. You can see the mosquito which have a white and black bands on their legs, and they bite during daytime, and the same vector or the mosquito can cause also chikungunya. So when you get a fever which can be up to 103 to 104 degree, you get confused whether it is a dengue, whether it is a falciparum malaria, or whether it is a chikungunya. In Africa they get yellow fever, West Nile disease, and in India also you can get Zika. So we need to diagnose. Secondly, out of 4 or 5 people infected, only 1% gets symptoms. Other 3 or 4, they just get subclinical infection. Out of those people who get symptom, there can be fever, cough, little bit chest involvement, sometimes vomiting, diarrhea, dryness in mouth, sometimes there are bleeding disorders, and that can happen. Only 1% of them go to fulminant course. That is where you need admission in hospital. Sometimes people get worried when the platelet count goes down, and we can wait till 20,000 platelet count, which is normally more than 2 lakh, to go down, so that time we decide to give platelet transfusion or not. Otherwise, platelet transfusion doesn't help. To manage dengue, there is no specific treatment. We need to manage hydration, that is, give a lot of fluid so that people do not get dryness and they do not collapse. And secondly, fever. Fever management is by paracetamol. Steroid cannot be used. NSAID cannot be used because there can be bleeding disorders. And the current cause why it is increasing is because of intermittent rains. If there are continuous rains, because the Aedes aegypti mosquito, they grow and they thrive on stagnant water, and in intermittent rain there can be stagnant water, and therefore we need to be very careful. We need to have a mosquito management plan properly, and we need to work towards a proper dengue cure, which is not available anywhere in the world.